transplantation is a safe surgery. The incidence of life-threatening emergencies is low. However, if such an event should happen, the incidence suddenly becomes 100%. These are the commonly encountered emergencies in the literature. I categorize all these conditions into 4 groups. Each group shares some of the common features and thus limiting the number of differential diagnoses and making our diagnosis much easier. I recommend that you take a picture. This is very important in my practice. I've been practicing hair transplant for 18 years, and some of these emergencies do happen. Take a picture. In the first group, you have a patient with a drop in blood pressure and heart rate. Think of vasovagal reaction, lidocaine toxicity, and anaphylaxis. Vasovagal reaction, this is the most common emergency in hair restoration surgery. Presenting symptoms of fainting, hollow, weakness, diaphoresis, nausea, and syncope. You are all familiar with this. Lidocaine toxicities, numbness in the tongue and lips are pathognomonic. Lidocaine toxicity occur much more frequently in the era without significant premedication. Nowadays, it's very rare because of some reasons. First of all, our patients are adequately premedicated with benzodiazepine. Benzodiazepine counteracts the neurological side effects of lidocaine toxicity. Second, our local anesthetic is administered in staged and staggered fashion. The accumulated dose is much reduced. Number 3, we are now combining epinephrine and lidocaine. When injected to the scalp, lidocaine is confined to the area of injection. The systemic absorption is very much reduced because of the vasoconstrictive effect of epinephrine. Number 3 is the anaphylaxis, rash, pruritus, and urticaria. So now you have a patient who comes to you with a drop in blood pressure and heart rate. You think of vasovagal reaction only if the patient has not any rash. It's just simple to make the diagnosis. Now the second group, the changes in blood pressure and heart rate. If a patient has a drop in blood pressure and increase in heart rate, you think of dehydration, hypovolemia, or orthostatic hypotension. Take note, this is the second most common emergency in hair restoration surgery. I just said, first one is vasovagal, this is number 2. This is really common. The long surgery without fluid replenishment is the culprit. Prevention is the best strategy. During the surgery, allow frequent breaks with ambulation and fluid intake can prevent its occurrence. Second, the hypoglycemia. You have the blood pressure remains unchanged, there is an increase in heart rate. Diabetic patients who are taking any oral hypoglycemic agents or insulin, they are at risk. During long surgery, the patient might develop a drop in blood sugar due to inadequate food intake. Prevention is the best treatment. And now, epinephrine reaction. I happen 2 times in my practice. Epinephrine reaction occurs when epinephrine is inadvertently administered intravenously. This might also occur during the usual field infiltration. The presenting symptoms are anxiety, apprehension, palpitation, and perspiration. Fortunately, epinephrine reaction is short-lived and self-limiting. And now, the last one is the increase in blood pressure and drop in heart rate. This is epinephrine beta blocker reaction. This is serious and potentially fatal. In patients who are taking non-specific beta blocker like propranolol, Inderal, the only effect of epinephrine is to increase